It's Paul Joseph Watson filling in for Alex Jones today on this Wednesday, October 1st, 2014 edition. Obviously, we're talking about Ebola. We're going to go to your calls shortly. But an interesting article popped up, some information that's not been heard so far, not confirmed, but interesting nonetheless, from a potential CDC source talking about the travel history of this Ebola victim. David Knight, you have the story.
Yes, this is from redstate.com. Eric Erickson is the person who runs that site. He's got a radio show in Atlanta where, of course, the CDC is headquartered. And he said during the break of his radio station, an individual called the program, said he worked for the CDC. He says that he vetted the individual, established his credibility and everything. The guy said that gave him some information that was later confirmed in the press conference. He also said that the patient traveled from Brussels to Dulles, Virginia, and then on to Dallas, Texas. So he stopped over in Brussels and Dulles, Virginia before getting to Dallas from Liberia. He also says that the patient had come from a funeral in Liberia, and all this information was provided before the details came out in press conferences. Now, one of the interesting things that he says is that this person from the CDC told him that he went to the hospital with symptoms on the 24th, and they're saying in the press conferences that the first time he went to the hospital was the 26th, that he was starting to have symptoms at home, but waited for 2 days before he went to the hospital. They sent him home, and they came back another 2 days. So that stretches out the symptoms a little bit earlier, moves it a little bit more forward, if that's true. And he says he assumed that the guy was confused because the press conference said the 26th. So he texted the source, and the source came back and confirmed that, yes, he came in on the 20th and that he went to the emergency room with symptoms on the 24th. That would be very important because I would imagine anybody that had gone to the emergency room at that hospital on the day in question would want to present themselves to have testing. So perhaps even somebody on the 24th might want to take that precaution. He said they discharged him with antibiotics, and he returned again days later with watery diarrhea and other symptoms. They tested him at that time for malaria and then Ebola, and then put him in isolation on the 28th. So that's the information we have from that source.
So obviously the suggestion there is that he didn't fly directly to Dallas. I think we should probably check the flights from Liberia to Dallas, if that is a direct flight. You're saying that
there are no direct flights from Liberia to Dallas. If I looked at several of them, and of course you get a wide range of ways that you can get here, depending on the airline that you go. Minimum, you're going to go for 22 hours and 2 stops. And you can go as much as 33 hours and 3 stops. And it depends. I mean, it can take you through Brussels, Paris, Atlanta, Philadelphia, Houston. There's a lot of different cities that these different flights stop by. And of course, merely the fact that somebody doesn't present any symptoms of fever when they're getting on the plane doesn't mean that these symptoms won't begin during a 33-hour journey. So that's quite a long period of time. One other thing that I thought was kind of interesting is one American doctor who's currently being treated for Ebola says that he believes that he got it because he operated on a patient with a cesarean section, giving her a cesarean section, and did not know that she had Ebola. And so the question is, if this is the way that they're going to diagnose it early on and start to question people is by fever, they didn't take her temperature. I mean, you know, whenever you go to the hospital, they're constantly taking your temperature. So they didn't notice in the hospital, according to this doctor who believes that he got it because he operated on somebody that, you know, they didn't know that she had any symptoms. So that's just amazing. It's another reason that they need to halt the flights. It's another reason they need to tell people, we're going to keep you in isolation for 21 days if you're going to come into America. That's the way you stop this. You do it one or both of those things, whatever you do, but it could be contained if they wanted to contain it.
Okay, we're going to go to your calls now. Juliano in Texas, go ahead. You're on the air.
Hey, how y'all doing, guys?
Good. What's your comment today?
The thing that I don't understand is why are they not warning the citizens of Dallas? It is a multicultural, so many people that are in and out of this little hub. It's easily going to spread. And they're just telling us, oh, don't worry. You're not going to catch it. Now, what are we supposed to do?
Well, it's interesting you mentioned that because top story on Drudge Report right now, red linked. Kids who had contact with Ebola patient monitored. This is out of the Associated Press. I believe out of the comments we just saw earlier from Texas Governor Rick Perry. who said a handful of school-aged children who had contact with a man diagnosed with Ebola are being monitored. So I mentioned briefly earlier the fact that some school children were being looked at. Perry says health officials learned Wednesday that the children have been identified as having contact with the man and are being monitored at home. The unidentified man has been in isolation at Texas Health Presbyterian Hospital since Sunday. The man is the first person to be diagnosed with Ebola in the US. So this is just the first example of other potential Ebola victims who may have been infected with the virus. Obviously, this guy was traveling around for at least 2 days, maybe even 4 days, in contact with the community and family members. David Knight, your take on that?
Well, that's just it. I mean, the Liberian community themselves are very concerned about this because they're in contact with friends and family living in Liberia, where this has been the worst pandemic. It's been worse even there than in Sierra Leone. And they're saying, we don't understand why they won't tell us who this guy is so that we can, anyone who's had contact with someone, with that particular person can go get tested. They want to know what the person's name is, who they've been in contact with. And they're telling people in the Liberian community to stay away from social gatherings. They're very concerned about that because they've seen how it's ravaged and completely shut down their country.
There's a headline up on Infowars.com. How bad could it get? US government order of 160,000 hazmat suits gives a clue. That's out of Zero Hedge. Of course, we had that story recently out of the order that this company that creates the hazmat suits got from the Department of the State Department. Actually, it was that they'd ordered this huge amount of hazmat suits. And again, they've been preparing for this in some ways, but obviously not in the most important ways, as we saw at the Dallas hospital there. Phil in Florida, you're on the air. Go ahead, Phil.
Hey, good afternoon. Who's to say, first of all, that he was the person that brought it on the plane. He could have caught it from someone for 33 hours from someone on the plane, and they got the recirculating air going through the aircraft for 33 hours. You can infect 290, 300 people who are all on that plane.
Well, that's true. They're telling us that it's not airborne, but of course, if someone has it and they're sneezing or coughing, then that makes it airborne. The information that we reported earlier from the person who called into a radio show in Atlanta, Eric Erickson's radio show, had said that the patient had come from a funeral in Liberia, so that might indicate that he was the carrier. The key thing is that you isolate people before you put them in an closed area like an airplane, before you bring them to the country. It's a 21-day period. If we do it for dogs in the UK, we can do it for people who are coming from an area that's infected with this pandemic. It's not that difficult.
And of course, we had the story back on August 4th on Infowars.com. CDC concerned about airborne transmission of Ebola virus. Basically, from their own documents, interim guidance about Ebola virus infection for airline flight crews, they advised airline staff to provide surgical masks to potential Ebola victims in order to, quote, reduce the number of droplets expelled into the air by talking, sneezing, or coughing. The CDC also directs airline cleaning personnel to, quote, not use compressed air, which might spread infectious material through the air. So this was 2 months ago almost that they were directing airline flight crews to take precautions with flights, potential that Ebola could spread at least to a limited extent through sneezing and coughing. David Knight.
You know, Paul, I think back when HIV first appeared, and people really didn't know, could this be transmitted by mosquito biting somebody and then biting someone else? When you have a situation like this and you don't really truly understand all the modes of transmission, and I would suggest that they truly don't understand all the modes of transmission, or you wouldn't have 200 nurses and doctors who have died in country. I mean, are they just overworked and tired, making careless mistakes? Are they being cavalier about the protocols, or are there methods and modes of transmission that they don't fully understand? You have to err on the side of caution. That's why we say they ought to stop flights in. They ought to allow, if they're going to have somebody come into the country, they need to be quarantined for 21 days.
Kelly in Texas, you're on the air. Go ahead, Kelly.
Good afternoon, gentlemen. God bless you both. Hey, typically this patient that went to the hospital and then he was turned away is it not common? I think it's typically they send you to a pharmacy to get your meds and not give them to you there at the hospital since they send them away. And also the second person, if it was a family member, did they not know go to a store or somewhere to get this person food or stuff for comfort and liquids? And wasn't there a story out that they've proven that Ebola was airborne between piglets and monkeys? And they ended up having to slaughter all of them because of that?
That's right. That was a 2012 Canadian study. They basically took pigs, put them in a pen with monkeys separated only by a wire fence, pigs infected with the Ebola virus, and the monkeys caught the virus via airborne transmission via the respiratory system, and they died, basically. So they proved that, at least to a limited extent, Ebola had gone airborne back in 2012. The Associated Press is reporting that 16 to 18 people are now being monitored as having potentially been exposed to this Ebola virus there in Texas. So as he said, this individual could have gone to the pharmacy to get his antibiotics. He could have gone to the store. And then these 16 to 18 other people could have interacted, with their family members, with their friends, with their relatives. So this is obviously of concern. But thanks for the call. We're going to Joshua in Texas. Joshua, you're on the air. Go ahead.
Yes, sir. Actually, first I'd like to say thanks for taking my call. I got in pretty quick. I did what you guys suggested, and I did call the White House. I got a hold of the I believe it was a comment board or something like that. It was a switchboard, and I asked the lady who was on there. Asked her, why is the president not allowing flights to be stopped from West Africa when countries such as the United Arab Emirates, France, and Britain are doing so? And she told me that she refused to comment on it, and that she would pass my comments along to the president. I then asked her, does the president doing this intentionally? Is he so incompetent that he's going to allow this to continue? And she refused to take my comments. So I just wanted to go ahead and put that out there. I just want to let you guys know that.
Well, that's precisely the issue. I mean, it is either the most astounding incompetence we've ever seen, or it's a deliberate policy. Neither one of them are a good outcome of this. But we see this over and over again. Nobody in the government wants to say anything, give us any information. They have absolutely nothing but contempt for our right to know information, and they just want to protect their job.
I think a good idea would be to maybe start a petition on the petitions.whitehouse.gov website. Maybe we can get the writers on that. It's probably already there, to be honest. I would assume that some people have demanded that they halt flights out of West Africa in the past, but we could start a new petition on that website, write an article about it, and get people behind that. Obviously, only people in the United States can sign those petitions. It's on record who they are. So that might be a good way to corral people around this urgent activist issue of trying to encourage the White House to stop those flights coming in out of West Africa. Dave in Texas, you're on the air. Go ahead.
Hey, guys. I just wanted to talk to you about something that I heard in that press conference that's ridiculous. Apparently, this guy was sent home with antibiotics for a virus. And by the way, I'm an ER nurse. I interviewed at Presbyterian Dallas last Friday. It was in another department, but getting back to this prescription, you don't prescribe antibiotics for a virus.
Yes.
Not ever.
Yes.
It's completely ineffective. So them claiming that there were no symptoms, that's an absolute lie.
Mm-hmm.
There had to have been symptoms to prescribe antibiotics, period. Now, those symptoms may not have been a virus, but they were symptoms. So, that whole thing is a bunch of BS. And as for, not canceling flights out of West Africa, I don't think it takes a genius to realize, specifically what's going on here, because that's 101.
We've actually got the name, if I could just stop you there, Dave, of the Ebola victim. Thomas Eric Duncan is the name, now being confirmed, who left Liberia on September 19th, arrived in Dallas the following day. As we mentioned earlier, he had to go through at least 2 other airports to get there, maybe Brussels, maybe Washington Dulles, maybe Paris. But Thomas Eric Duncan has been named as the Ebola victim there in Dallas. I saw another tweet, I believe, on the same article, if you scroll down a little bit, saying that he's now in serious condition.
So he's not a citizen. They pointedly avoided that. They said they asked him for his Social Security number when they were giving him a prescription, and he said he didn't have one. They also have the name of his sister that he was visiting. Can you read that, Paul? It was
Duncan, yeah.
M-A-I?
My Worry is the name of his sister. Not sure about the pronunciation.
W-U-R-E-H.
Said he notified officials that he was visiting from Liberia when they asked for his social security number, and he told them he didn't have one. So this is not a U.S. citizen by the looks of it, but now his name has been confirmed as Thomas Eric Duncan, and now they're saying that he's in, quote, serious condition. I believe in the press conference we went to earlier, they said he was stable, so it seems his condition has now worsened. David Knight.
Well, that's a shame. I'm sorry to hear that. To be clear, they're not going to be able to stop flights coming from West Africa to the United States because, of course, they're going to have to go to intermediate destinations before they get here. There aren't any direct flights from Liberia. But what they need to do is they need to vet individuals and not clear them for flight to the United States if they are not quarantined. And so that needs to be focused on that in terms of the detail of the policy. Of course, there aren't any direct flights. I know people are going to complain about that. Yes, we are aware that you can't get a direct flight from Liberia to the United States. Nevertheless, the principle involved that you're going to vet people, that you're going to watch them the same way they do dogs coming into the United Kingdom. It's just a quarantine method. And it's a way to keep it contained before it gets to the point where they're going to start enacting martial law and letting FEMA run riot over the United States, which is really what they want. That's what they've been preparing for. They haven't been preparing for containment of a disease. They've been preparing for containment of the population. And this is what they want. They want something to happen. I believe that it's not staggering incompetence. I believe that it's a deliberate plan, that they're deliberately opening the borders and not screening people for these diseases.
And a lot of these Africans coming in, flying into Europe, for example, are obviously immigrants. France has a lot of African immigrants. Air France, from the article I was reading earlier, they did ban direct flights from Liberia. So obviously those first ports of call in many countries, Arab Emirates, United Arab Emirates was the other one, they have banned certain flights coming in from West Africa. So they've taken that precaution. We'll be back with more of your calls. Gerald Celente coming up in the next hour. David Knight riding shotgun. I'm Paul Joseph Watson, hosting the Alex Jones Show. Infowars.com. More breaking news coming up. Keep it locked in. It's the Alex Jones Show. I'm Paul Joseph Watson, covering the latest Ebola news. Gerald Celente is coming up in the next segment. We're going to switch gears, talk about Syria, geopolitics, the Middle East, and the latest financial news. But now we're going to go to the final two callers. Alex in Wisconsin, you're on the air. Go ahead.
Hi, can you hear me?
Yes, go ahead.
Yeah, I work in mold and asbestos remediation, and I just can't help I've been following the Ebola situation, and I can't help that even the most basic things we use for contamination in our suits, such as duct taping over the sleeve work and at the ankles, they're just not doing anything. And it's really kind of surprising me.
Well,
I was wondering if you guys think it's possibly some sort of false flag operations. I've heard things that maybe somebody poisoning the wells down there, which is causing similar symptoms to Ebola.
Yeah, I mean, there have been a lot of theories from the local population in those African countries about that. Potential, false flag, deliberate infection, testing by the United States. None of that's been confirmed, but those rumors have been flying. And yeah, I mean, hundreds of health workers have died. You would expect them to take the proper precautions, given that it's not airborne as far as we're being told, but hundreds have died. We're going to fit in the final caller here. Robert in Canada. Go ahead, Robert.
Hey, thanks for having me on. Listen, it's quite obvious people need to wake up on this issue. Right now, there's a purposely enforced globalist governmental negligence in force right now. We need to continue to link this issue with other past issues like AIDS, genetically altering our food to make us sick. There's been a huge population control program that's been in effect from the U.S. since the 1950s, linking back to Tuskegee. And we need to continue to link this with what's going on now. And they want this to get out. They want it to get out. Even if this is a testing ground, they want it to get out. Mm-hmm. We don't know if it's the big one, but it's a testing ground if it's not the big one. And people need to wake up. Like out here in Canada, they're asleep out here. They're absolutely asleep. They're not concerned. Look at the public, how they're not concerned about this in the U.S. They're not, because the good old USA is going to take care of us. Well, that's a myth. And they're asleep because this is really how deep that the brainwashing is in the U.S. and around the world. It runs very deep, and this is why these people, the public, the mass public, is hard to reach.
You know, let me jump in here and say this is about population control. It's about population control via martial law. It's about population control, reducing the number of people. They see people as a disease. That's the whole Gaia theory. So they're not concerned about controlling this disease. They want to control population in every sense of the word. Absolutely, you're exactly right.
And now they're saying, New York Times reporting, health officials in Dallas say Wednesday they believe the man who is first confirmed case of Ebola virus in the country had come into contact with 12 to 18 people, including some school children, when he was experiencing symptoms. So now 12 to 18 people potentially exposed to the Ebola virus. We're going to continue to track this. Gerald Celente coming up after the break. David Knight, final comments on this Ebola situation as we prepare to switch gears here.
We just had the first caller that we had in this segment talking about how he worked in the mold and asbestos industries where they sealed things off, even with duct tape. When they brought these fellows over, the first people they brought over, they weren't putting them in level 4 biohazard facilities. And we interviewed people who worked on development, were trying to develop Ebola vaccines, and they were absolutely appalled at the lack of proper procedures that were being taken with the people that were being brought in this country as well as into the UK.
Third hour coming up with Gerald Celente. We're going to switch gears, talk about Bitcoin, Syria, ISIS, and the global economy. Gerald Celente, Trends Research Journal. This is The Alex Jones Show, live, Infowars.com. Stay tuned. Third hour of The Alex Jones Show, this Wednesday, October 1st, 2014 edition. Gerald Celente coming up. We're rounding up the Ebola news now, of course. We just went to the press conference earlier with Joe Biggs live on the scene, Governor Rick Perry and other health officials, CDC officials, trying to obviously downplay the situation, prevent hysteria. As I said earlier, the bigger threat than Ebola may be the hysteria that could be engendered as a result of maybe the mishandling of this situation, which appears to be the case with this Ebola victim who was not diagnosed on his first hospital visit. He was given antibiotics and sent home. Will CDC activate emergency measures after Ebola confirmed in the US? That was our story yesterday, which was linked up on the Drudge Report. Obviously, we've got these provisions in place by the CDC to quarantine healthy persons who do not show symptoms of the disease under the medical martial law infrastructure that has been established in the United States for well over a decade. But on the flip side, David Knight, they're now saying, obviously trying to downplay the situation. And I noticed quite a simpering, a lecture tone from both the mainstream media and the health authorities saying, don't panic, don't get worked up about this. And yet they're the ones who have dropped the ball. So we should really be asking even harder questions.
Trust us, we're the professionals. There's nothing to worry about. We've trained on this. We've got this. We've been working on this for a long time. And yet they do not address why they sent the guy home, failed to diagnose. And then when the press conference started and they were actually able to ask questions, of course, that was one of the first questions that people came up with is, how could you possibly miss this? And, well, we just didn't have the information. Why? Because they didn't ask for it. We have to question the methods of transmission, whether they fully understand it. As I mentioned before, one of the doctors that's currently being treated for Ebola, and it's interesting that the way he's being treated is with blood transfusions from Dr. Brantley, who survived. And that's something that's developed as a large black market in the blood of survivors in Africa. But he believes that he got it from performing a cesarean on someone that was not diagnosed. And the question is, well, if it's as simple as just checking their temperature, if you're working in a country where there is an Ebola pandemic and you're not checking people's temperature in the hospital, I mean, I just don't understand that. But I would be curious to know how Dr. Brantley and others believe that they contracted this disease. We've had over 200 doctors and nurses have died in West Africa, many of them Westerners. And so it isn't a question of them having a different protocol than the CDC or Western medical authorities are saying. These are people who are coming over, exercising the CDC protocols and still contracting the disease. So does that tell us that they're being careless about this, or do they just not understand fully the mode of transmission?
And we've got an interesting quote, actually, as you mentioned there, David. Dr. Kent Brantley, a survivor of the disease, obviously, he reacted to this latest case, this first case of Ebola in the United States, with the following comment, which is really interesting. It sounds quite volatile, but he said, "Many have used the analogy of a fire burning out of control to describe this unprecedented Ebola outbreak. Indeed, it is a fire. It's a fire straight from the pit of hell. We cannot fool ourselves into thinking the vast moat of the Atlantic Ocean will protect us from the flames of this fire. Instead, we must mobilize the resources to keep entire nations from being reduced to ashes." And there you see the article up from Dr. Kent Brantley, who was a survivor of Ebola. Quite inflammatory comment.
And to be clear, in places like Liberia, where this guy who's currently being treated in Dallas with Ebola, where he came from, in that country, and in Sierra Leone, they are not showing any signs of getting this under containment. It is still spreading. They have had some success in Nigeria, but not in those countries. It is still expanding.
We'll be back after the break with Gerald Celente, switching gears into the Middle East, geopolitics, and the latest financial situation. Gerald Celente, Trends Research Journal. This is the Alex Jones Show live. Stay tuned. Infowars.com.
In the past decade, we have witnessed unparalleled scientific discoveries in the area of health. But no one has put together a formula that focuses directly on brain health, nerve growth factors, and optimizing your cellular energy at the same time. DNA Force is one of the most expensive formulas to produce. Some of the ingredients in DNA Force are $12,000 a kilogram. We are using the coveted, patented, only American source of PQQ, CoQ10, and more. You want the best that's out there at the lowest price anywhere? Well, we're bringing you a total win-win. The ultimate value, cutting-edge, trailblazing game changer that also supports the InfoWar. We have produced a limited run of DNA Force, and it will take up to 12 weeks to produce more once we sell out. Secure your DNA Force today at InfoWarsLife.com or call toll-free 888-253-3139. DNA Force from InfoWars Life.